Hello everyone. Today we are going to discuss about application of POP. Me, Ms. Jansi, going to take you through working as a tutor at Triple M College of Nursing. The objectives includes at the end of the lecture, listener will be able to know the properties of plaster of Paris, know the purpose of the application of plaster of Paris or cast, understand what are the types of the upper and lower limb cast and when to apply them, enumerate the application of cast, and to know the list of do's and don'ts while applying. Introduction. Plaster of Paris is a popular chemical substance that is used most commonly for sculpting materials and in gauze bandages. While we have seen many applications of this material in our everyday lives, if we try to understand its chemistry, plaster of Paris is a white powdery chemical compound which is hydrated calcium sulfate that is usually obtained from calcining gypsum. So in other words, we can say that the plaster of Paris is usually made up of heated gypsum at a high temperature. A plaster cast consists of a cotton bandage which is covered in plaster of Paris. The bandages are applied when wet and harden as they dry. Often different colored bandages are offered to the patient, especially to children in abroad. Plaster casts are used in treatment of fractures, that is the broken bones. This is the introduction. Moving on to the properties. So what is the composition of this plaster of Paris? So it is usually white in color, as you see here, and available in powder form also. When water is added, gypsum crystals are formed, leading it to achieve a solid state. The exothermic setting process can be catalyzed by sodium chloride. The plaster of Paris is retarded by alum or borax. So this forms an anhydrous calcium sulfate at 473 K. This is sometimes known as the dead burnt plaster of Paris, also known as gypsum plaster. So the properties is mainly gypsum crystal. So this and so it is catalyzed by the sodium chloride. It is the other name for this is gypsum plaster or plaster of Paris. Purpose. So the purpose is to immobilize the body part to allow the parts of the bone to heal in the correct position. Okay, now let's see the types of casts. What are the different types? So first type is split bivalve cast. For some injuries, the first cast may be split in order to allow room for swelling. So the sides of the bivalve cast will be taped with cloth, medical tape. So here as you see, bivalve tape will be applied over the cast. So this is known as split bivalve cast. Next, cast of upper extremities, especially in your arms, wrists and finger. So how it is used? It is used for forearm wrist fractures. So here is the forearm. This is short arm cast. So applied below the elbow, as you see here, it is applied below the elbow till the fingers. So also used to hold the forearm or wrist muscles and tendons in place after the surgery. So this is short arm cast. Next is long arm cast. So this is known as long arm cast. As you see, it runs from the upper arm down the elbow till the forearm. So this is mainly used for the entire arm fractures, applied from the upper arm to the hand. Also used to hold the arm or elbow muscles and tendons in place after the surgery. Next is shoulder spica. So this shoulder spica, it is used for shoulder dislocations or after surgery on the shoulder area, applied around the trunk of the body. So it is applied around the trunk of the body, as you see here, till the forearm. So applied around the trunk of the body and shoulder, arm and your hand. The entire part is covered. This is shoulder spica. Next is cast of lower extremity, that is short leg cast. Short leg cast. So this includes hips, legs, knees and ankle. Cast of lower extremity includes your hip, legs, knees and ankle. So this is used for lower leg fractures, ankle fractures, severe ankle sprains and strains. It is also used to hold the leg or foot muscles and tendons in place after surgery to allow for the healing. It is applied to the area below the knee down to the foot. And this may be the person may be walked on once the fracture is stable enough to bear weight without becoming re-injured. So this can be also walked on once the fracture is stable to bear the weight and to avoid getting re-injured of that particular part. Now, leg cylinder or long leg cast. Leg cylinder, as the name indicates, it is cylindrical from the entire leg, upper thigh to the foot. Okay, so used for knee or lower leg fractures, knee dislocations or after surgery on the leg or knee. Applied from the upper thigh to the ankle or foot. Usually applied with the knee bent to prevent walking on the cast. Usually applied with the knee bent to prevent walking on the cast. Next is unilateral hip spica. As you see here, unilateral, the word indicates single. So one-sided, yes, as the name indicates, one-sided hip, around the hip, it's known as spica. So used for thigh femur fractures, also used to hold the hip or thigh muscles and tendons in place after the surgery, applied from the chest to the foot of the affected leg. Applied from the chest to the foot of the affected leg. This is unilateral hip spica. Next, 1.5 spica cast. What is 1.5 spica cast? Used for thigh fractures, also used to hold the hip or thigh muscles and tendons in place after the surgery. Applied from the chest to the foot on one leg and to the knee on the other leg with a bar placed between both the legs to keep the hips and legs immobile. Next is the bilateral hip spica. Bilateral, as you see, both the legs is getting affected. So used for pelvis, hip or thigh fractures. Also used to hold the hip or thigh muscles and tendons in place after the surgery. Long leg. Next is bilateral hip spica, used for pelvis, hip or thigh femur fractures, also used to hold the hip or thigh muscles and tendons in place after the surgery. Long leg. It is applied from the chest, as you see here, from the chest to the feet with a bar between both the legs to keep the hips and legs immobile. To keep the hip and the legs immobile. Short leg is applied from the chest to the thighs or knees. Long leg is from the chest to the feet and short leg is from the chest to the thighs or knees. Next is abduction or frame cast. Abduction, it is used to hold the hip muscles and tendons in place after surgery to allow time for healing. Apply from upper thighs, as you see here, from the upper thighs to the feet with a bar placed between both the legs and hips immobile. This is abduction of frame cast. Okay, so these are the types of cast. Now we are moving on to the articles, what is required. So articles required are plaster of Paris, stockinette, padding and warm water to be soaked with the plaster of Paris. So application. What is the application? How can we apply the plaster of Paris? Ensure that the limb is in correct position for applying the cast. Cover the skin with stockinette, web roll or padding without any wrinkles. Cut stockinette longer than the expected finished length. Soak the plaster roll in bucket of water until bubbles cease to rise. Remove from the water and gently squeeze the excess water from the roll without drying it thoroughly. Just gently do it and apply the POP on top of the cotton wool padding from distal to the proximal end without applying tension over the roll, overlapping each layer by 50%. Just gently apply it. Use figure of 8 technique around the joints and prevent wrinkling of the plaster by smoothing the layers down with your palm. Ensure immobilization of joints above and below the injury. A slab splint, that is a back slab, is usually applied and secured with a cling bandage to allow for swelling in the acute setting. Once the procedure is over, clean the excess casting material from the skin of the patient. An X-ray can be taken to verify correct bony alignment. So these are the application. How could we care for it? Drying of the cast. So in general, plaster casts are applied for between 6 and 8 weeks, although it can be more or less depending on the severity and location of the fracture. So almost 6 to 8 weeks it can be left for drying, although it can be more or less depending on the severity or location of the fracture. Okay. How do you educate a patient? We had seen what is the definition, how to what are the application and what are the different types of casts and what are the articles required. Now moving on to the education. So after application, after 6 to 8 weeks, so during that period you have to educate a patient. So what all will be the do's and what all will be the don'ts to be educated by a nurse. So keep the cast clean and dry. Check the cast often for the cracks and breaks. Cover the cast while bathing. All these are the instructions you have to give. What a patient should not do. Don't scratch the skin under the cast by inserting objects or fingers inside the cast. If it is itching, you should educate the patient that don't scratch it with any objects. Don't insert any objects inside or finger inside the cast to scratch the itchy skin. Don't pull small toys or objects inside the cast. Avoid sand, dirt and mulch. Loose particles may work in their way into the cast and irritate your skin. So avoid sand, dirt and mulch. Keep it safely. Don't put powder or rub lotion inside the cast. Don't put powder or rub lotion inside the cast. This is about the patient education. So hope you understood the topic. These are some of the references. Thank you.